Welcome everyone, and thanks for taking the time to join us for this webinar today on mental health, the NDIS and people living in rural and remote areas. My name is Liz Wilkinson. I'm a project manager with the Mental Health Coordinating Council of New South Wales. And before we begin, I'd like to take a moment to acknowledge the custodians of the lands on which we're all joining from. And for where I am, that's the Gadigal people of the Eora Nation. And I'd like to pay my respects to their elders past, present and future, and also acknowledge their continuing connection to land, water and culture. Today's webinar is brought to you by the Mental Health Coordinating Council, which is the peak body for community managed mental health organisations in New South Wales. And it's part of our reimagine.today project. And if you're not familiar with Reimagine Today, it's an online resource to support people living with mental health conditions to access the NDIS through the psychosocial disability stream. Now, Reimagine Stage 2 is the project, and it was funded by the NDIA. And part of our work over 2019 to 2020 was to improve the website to make it more accessible to a broader range of communities. And that includes people living in rural and remote areas, as well as Aboriginal and Torres Strait Islander people, people from multicultural backgrounds and LGBTIQ+ people. And we've been working alongside project partners and community members to co-design new resources to support other people on their NDIS journey into the future. So I'd also like to acknowledge today a couple of our other partners on the webinar, and that's Marathon Health, who work out in Western New South Wales, and Country Care Connections, which is also known as Rural and Remote Mental Health, which are based up in Queensland. A quick note on housekeeping before we continue, that you really can just sit back and watch and listen to the webinar. But if you have any questions, you can also submit those through the Q&A function, which is you click on the Q&A button at the bottom of this window, and it'll open up a Q&A box, which you can submit a question through at any time. We will try and get to those today, but we have already had a lot of questions submitted in the registration, so we'll get to them today or afterwards. So now I'd like to hand over to my co-host, Mark Noble, who is a mental health consumer consultant in Dubbo, New South Wales, and who will share an acknowledgement of lived experience.
Thanks, Liz, and welcome everyone. As Liz mentioned, we'd also like now to acknowledge people with lived experience of mental health conditions, their families and carers, including those online today, and recognise their many contributions to the community and the mental health service sector. Now, as Liz mentioned, I'm Mark, and Liz invited me to co-facilitate today to help give a more rural frame to our discussions, as I have experience as both a consumer and professional in the mental health space in Dubbo, as well as the more remote communities of Western New South Wales. Today, we'll look at some of the unique challenges of people living in rural and remote areas when it comes to mental health and service access. We'll explore some of the challenges of NDIS access and planning in rural and remote areas and practical ways to overcome them. We'll briefly look at some of the free resources available to support people with the NDIS process. And we'll answer some of your questions with a panel discussion. To start with, I'd like to welcome Shana Turner, Team Leader of Wellbeing and Psychosocial Supports from Marathon Health, which serves large parts of Western New South Wales, to highlight some of the key challenges we face in rural and remote areas generally in this space. Hello, Shana.
Hi, thanks, Mark. Hi, everyone. As Mark mentioned, my name is Shana, and I'm the team lead here for the psychosocial and wellbeing programs at Marathon Health. So today's focus is around the domain of psychosocial disability within the NDIS, and in particular, some of the challenges that a person may face living in a rural and remote area. Geographical distances. Some people may live hours from their local town and even further from a major city. Lack of public transport and capped transport funds can make it financially financially unviable for providers to send staff to some of the areas that our participants live in. Thin market. When we talk about NDIS, we know that the scheme was built around choice and control and person-centred approaches. This is one of the brilliant benefits from the scheme. However, if we only have a small amount of services providing support in the area, or at times no other services in the area, the participant is unable to have that choice and control. Qualified workforce and access to allied health is also another barrier. In regards to obtaining access to the scheme, we are finding that some people are not being able to access information around services that can help them get the information that is required for the process as well. So not only do people in rural and remote areas are not as informed as somebody that might be living in Bathurst or Sydney around what supports they can find or have in their lives, they're unable to get the evidence needed to actually even get onto the scheme. So there's some of the things that I know many people in the area have been experiencing, and we're going to today talk about some of those barriers and how we can give suggestions that we can work through them. So thank you. Thanks, Mark.
Thank you, Shana, and thanks for that discussion. And next, I'd like to welcome Debbie Smith, who's joining us from Queensland. Debbie has a wealth of experience getting people into rural areas onto the NDIS through her work as a support coordinator with Country Care Connections, as well as her experience as a parent with children with NDIS plans. Deb will be talking through some of those challenges, but also practical solutions around NDIS access. Thank you, Deb.
Thanks, Mark. Liz, thank you. So a little bit about Country Care Connections. We are based all around Australia, and most of our work has been done in Queensland in the Darling Downs region, particularly the Western Darling Downs region. Thanks, Liz. You can just skip through fairly fast. Thanks. Okay, so there's 3 ways that you can access the NDIS. If you were on some kind of program, you have probably been transitioned over to NDIS. You may be contacted to get more information to NDIS to see if you're still eligible. The other way that you can access it is by ringing NDIS direct, and the phone number is there on your screen, and filling in the access request form or the evidence of a psychosocial disability form. And those forms, I think, Liz, we could put some links up for those forms later. Next, thanks. So this is basically it. You contact NDIA, you may be referred to a local organisation to also assist you in filling out those forms. Then you send the forms in, hopefully you'll have access approved, and then you move on to a planning meeting. This is a very positive outlook. Thanks, Liz. All right, if you've been contacted for more information, it's the same type of thing. Just get the information and send it through. So the access report forms, they must definitely include a diagnosis and how these were assessed. All right, quite often we will put a diagnosis on a form, but not explain how that was assessed or who diagnosed. Also the length of illness, what treatments have been tried in the past, and what current treatments and status. A lot of people miss those things, which is why they're then not found eligible. Sorry, phone's ringing. Okay, some of the professionals may need some education. There's a lot of fact sheets on the NDIA website that you can access to take in to see your GP. Thanks, Liz. Other documentation you can get apart from those forms is if you've got any reports from psychologists, psychiatrists, any service providers, GP, occupational therapy, but don't forget the people around you as well, carers or family members who may have been impacted. Thanks, Liz. When it comes to planning your NDIS funding, before you go into a planning meeting, have a look at all the different areas within NDIA that they may fund, okay? So the general day-to-day living things, how you communicate with people. When we talk about mobility, quite often NDIA will ask questions such as, can you walk a kilometre? And the answer may be correct, but can you actually walk a kilometre outside the house by yourself. All right, so think a little bit outside the box when you're going through these questions. Right? How do you react with other people? Can you form relationships? Is it a struggle to keep relationships? Okay, how do you access community, the social and civic life? Right, these are all the goal areas or the planning areas that NDIA will look at. And of course, education and training and employment. Thanks, Liz. So start planning now, even before you access or attempt access to NDIA. Start writing out some lists of how you think NDIA could help you live a more normal life, right? Ensure all of your reports and all your evidence match these goals. Thanks, Liz. If you can access an email address to send reports to directly, do so, all right? And take a support person with you to the meeting if possible. Right? If you are currently supported in any way, get a report from them so you can cross-reference that. Right? And mention assistance to get started. If this is your first plan, support coordination will assist you in linking with services and helping you find services and linking it back to your goals. When we're living in rural and remote communities, always ask for plan managed or self-managed plans. Plan manager is like an accountant who will pay all the invoices, whereas self-managed, you can make the payments and then claim them back from NDIA. It allows you a lot more flexibility. You do not need to access only NDIS registered businesses this way. Once the plan is approved, contact your planner or the LAC for a breakdown of the plan. For those of you not familiar with LAC, it's Local Area Coordinator. Any current supports that you have, inform them that you've now got an NDIS plan, talk to your coordinator and link with a plan manager. Thanks, Liz. Now, we know it's not a perfect world. If access is not approved, it's not the end of it. You can request a review on that decision within 3 months, or you could reapply after 3 months once you've got more evidence. The plans, if you get one and it's not funded the way you expected, you can, or something is missing, again, you can review that decision within 3 months. Or if your circumstances change, you can also request a review. First plans are first plans. Normally they only last for 12 months for a first plan. Sometimes when you've been in NDIA for a little bit longer, they may extend those plans out to 2 years. All right, so a review is coming up. It's not the end of the world. Some other little tips. If you are ringing NDIS or NDIA, try and do it in the early evening. They've actually got a phone hotline open more than just business hours, so you don't have to keep it just within business hours. Right, copy everything and send it via registered post or email. Put your NDIS number on everything. When you first contact NDIA, they will give you a phone number. So keep that phone, NDIS number. Keep that and put it on all your documentation. We do know that documentation does get lost. And I've already mentioned about thinking outside the box with your with questions and how to answer the forms. So that's the one I mentioned before. That one is the most common one. Can you walk a certain distance? Yes. Can you cook? Yes. All right, you may be able to cook, but do you forget that you left the frying pan on, or are you always concerned about leaving the gas on when you leave the house? Those types of things. Good luck with it all.
Thanks, Deb, for that very insightful advice and I think very helpful advice. You mentioned through that the idea of goals as far as your plan is concerned. Now that suggests to me that that the plans are created around establishing a particular level of function or a particular level of lifestyle. Can you give us a little bit more information on that? Is that the case?
That is absolutely the case. They actually call it an ordinary life. For people who don't have a disability, what can they do that we can't do?
Right.
And that's what NDIS will actually fund, as long as it's reasonable and necessary. And I could talk for about 3 hours on that.
Right. Well, we don't have 3 hours to go with, so we'll leave it there. But okay, but thanks very much for that. Next, I'd like to welcome back Shana and her colleague, Rowena McCauley. And Rowena is the Group Manager of Commercial Services at Marathon Health. And they're going to talk through some of the tips for managing challenges when you have an NDIS plan. Go for it, girls.
Hi everyone, thank you for joining us for today's webinar. We'd like to just acknowledge that we're calling in today from Wiradjuri land and pay our respects to Aboriginal people joining us for this webinar. As Mark said, I'm Rowena. I'm the Group Manager of Commercial Services here at Marathon Health, and you've already met my colleague Shana. Next. At the next slide, thank you. So Marathon Health delivers services mostly across a lot of New South Wales. Shana and I predominantly work from the Dubbo and Bathurst offices. So you can see on the map that specifically for this webinar, we're talking about those remote locations in those zones, although we do have services that operate down into the southern end of Wagga and Albury and into Canberra. Next slide, please. So in our experience and learnings when working in rural and remote areas, what we've learned is that education is key. So not just for the participants, but also for your employees. So we work with a number of support coordinators and allied health within our organisation, and we ensure that having those resources to educate themselves is one of the major successes in working in these locations. So talking about all options for plan management for clients, not one option will work for every single person. So talk to your clients, do they need to split the way their plan is managed? They may need some part of their plan self-managed to work with certain organisations or individuals within the community, and some may be plan managed. So it's really about getting the best out of your plan so that those participants can meet the goals of their NDIS plans. Walk the streets. So when you're working in rural areas, we find that most of the staff that we work with aren't actually locals, and we travel to a lot of locations. Walk the streets, knock on doors, and go out and meet people. Learn what services are available in that town, what services are offering outreach in those towns, and are there virtual services that are available for use within those towns? That not only creates knowledge, but it also builds networks and a face to talk to in that community. Talk about expectations with your clients and have those open discussions so that there's no confusion around what services can be provided. If, for example, it's difficult to get some allied health support in some rural locations, so if you have a participant who'd really like to have an occupational therapist who specialises in something, it may not be possible. So have those conversations with them and talk about the possibilities that there are so that expectations are managed, but at the same time so that those participants still have the choice and control over their own services and are meeting the goals of their plans. Knowledge is power. I know that's an old saying, but it is. Know the plans inside out from your participants. What are they funded for? Are they stated supports? Are they not? How can they use their plans flexibly to get the best out of them? Know how the NDIS works. So know the systems, know where the access points are, who your local contacts are. And also know about the supports around your participants, so their family, their carers. Do they have community groups? Where there are gaps that can't be met in the plan, can you access those support systems to deliver some of those services?
Next. So building client support. So common challenges in small communities. relationship breakdowns and confidentiality. So in small communities, everybody knows everybody. So every support service, every doctor, every family member, and that can make it really, really hard when you're trying to help people achieve their goals and maintain confidentiality. So there's some options around that. So capacity building from the person's network and community. So what that means is if we're a service that isn't actually based in the community, we're a service like sometimes Marathon Health comes into that community, is link in with different groups. Like there'll be an LHD group that might meet once or twice a month. There'll be some other community service groups that have already built their support network. Try and tap into them and say, you know, we're here, we would really like to help. Support to register for personal care and community care access and support workers. So if you've got some people that are in the community that are actually, they might be family members, or they might be the lady that always lived down the road that helped shower somebody or takes them shopping, help them register to be able to provide that kind of help ongoing in the most appropriate way. Providers may extend service delivery if there is a need. So what that means is that we know we're signed up to do a job, but when we go out there, the participant might need more. So we're going to talk to them, we're going to talk back to the NDIA and help them have a voice and say, this is my plan. However, what you've popped in it is not supporting my needs. So we will help them do that. Work with NDIA and LACs and their representatives, and that's a big thing. So have those conversations, get to know each other, work alongside each other. That's the biggest key, is get out there and network. That's like Rowena said, walk the streets, get to know your pharmacists, get to know the GP. Everybody will know everybody, and that is not always a bad thing. Look outside the ordinary scope of your hospitals and things like that. That's what we're saying. So the pharmacists. So for an example, we do go into some small towns and they may not have many services there, but we go and talk to the local pharmacist and he says, oh no, we do that. We take the medication to the people's homes, and so they will adjust. Small towns adjust. And so if you get to know what is already being provided, you can work within that. Next. So dealing with in-market, like I said before, so organise with provider letters to demonstrate why funds have been unable to be used. So sometimes in these rural and remote areas, for different reasons, it might mean the participant is unaware of what they could utilise their funds for. It might mean that the service is just not available in that area. So I guess it's talking to NDIA and letting them know that it's not that the participant doesn't need the funding. It's not that they chose not to use it. There's other barriers that are in place that has stopped that. And like I said, use mainstream support. So your pharmacies, your GPs, community groups, your men's sheds, your Country Women's Association, schools, daycare centres, everybody tends to help each other out. And the other thing is that sometimes, like Rowena said, it's not always possible to have these services come in and be in the community every day face to face. So some of the things that we've been able to do in the past is that we have satellite services like telehealth are able to link in and to help stop the barrier of that confrontation of scaredness that some of our participants with psychosocial disabilities have of talking through computers and not knowing the person, is that the support worker will sit with them. They will explain what might happen during the session, and they'll be that person of comfort and reassurance and advocacy for that participant to still be able to receive all the supports they need via a distance. Next, please. Collaboration, not competition. Big thing. Particularly in small, actually everywhere. There is enough business for everybody. And at the end of the day, we all want to have our participants' needs and wants at our forefront. So one of the things is that we need to work with our colleagues in organisations and different services to best support our participants. So some of the things that we do on a regular basis here at Marathon Health is that we share transport with other companies if we've got a mutual participant. We offer co-location. So I might go to a town a couple of hours away and I'll heat my lunch up and have lunch with a different organisation, or we'll borrow a meeting room and vice versa. Share, like I said, cars and flights and things like that. Another thing that happens quite regularly in our rural and remote areas for our risk and safety procedures is that sometimes we're not allowed to send out one staff member. We have to have 2 staff members to code. Now that's not always possible. So we will share that with a different organisation. So then we've got 2 different organisations coming together to support that participant. Work with health and corrections and other government sections. They are always open to come for a home visit, to borrow a room, or if you're finding it hard to engage with the participant, sometimes we're able to then piggyback on the back of a meeting that maybe corrections might already have or health might already have with these participants, to have that engagement supported, I guess, and communicate open conversations around what barriers we might be facing and other people may be facing the same barrier, and we can work together to get an outcome. And so, like I said, solution focused and network. You'll be having a conversation with one person and they'll be like, we're experiencing the same thing, let's see how we can get together and work this out. Or they might know that another lady in the next town does provide that service, so then we can get them to come in and hopefully help that participant. So just talk, guys. That's my biggest thing, is talk with each other and support each other, even if you're not from the same organisation, because we're all wanting to help each other in these communities. Next. And that's it from us.
Thank you very much.
Thanks, guys.
Thank you.
Okay, thank you very much, Rowena and Shana. That was some really valuable information and advice you've provided there. Now, at this stage, we had hoped to have a person with a lived experience of either as a carer or as a consumer of services from the NDIA, not from the NDIA, sorry, with an NDIS plan. However, we've found it particularly difficult to find someone with an NDIS plan that's actually willing to sit as a presenter and talk about their experiences in this sort of format. As it turns out, however, we're very fortunate that Debbie from Queensland, who we've already heard from, is a carer for her children who have, 2 of whom have NDIS plans. And so we're going to hear back from Debbie again now. Thanks, Deb.
Hi again, everyone. Meet my kids. So this is Connor, myself, Michaela, and Shyla. Shyla's the little sassy one on the end. Connor and Shyla both have NDIS plans. All 3 of them are diagnosed at various levels with autism. We also have mental health concerns, eating disorders, a whole range of different things, cognitive, speech, you name it, we've got it. It's there somewhere. So we started our NDIS journey with Connor, and he was transferred from an already approved program, funded program, and it was quite simply a nightmare. It was very difficult for us to explain, when he looks like just a great kid, what difficulties we were facing as a family supporting him, and in a rural community accessing services. And I would have to travel 4 hours for him to have a speech therapy appointment at that time. So it was quite difficult accessing the services, even when we did get a plan. We didn't have it plan managed, it was agency managed, which is why we had to travel. So it took quite a lot of conversations with NDIS to have everything changed for Connor, but we did. And I think that's the most important message that I'd like to get through to everybody, is don't give up. You know, have somebody else there supporting you along the way, because it can be a pretty tough journey. Now, with my little Shyla, as you can see, she is just full of energy. They also are all diagnosed with ADHD. Shyla also faces cognitive issues, intellectual impairment, speech. She has been diagnosed with a language delay. So looking at her again, I love this photo because it really does show the character of my kids. Looking at her, she's just an outgoing little kid, loves everybody. Her safety is a huge issue because of her love for everybody. Everybody she meets is a friend. She will hug everybody, kiss everybody. Up here, we call her the Corona fairy virus. You know, she's going to be the one who's going to sprinkle that virus everywhere if she ever catches it, which is why we very much keep her home as much as possible. But her plan, again, it was really difficult to find services and to find funding that would actually support her through this. The diagnosis, I've answered a question already about diagnosis. Diagnosis is important. Even though NDIA will say that it is all about functionality, no, it's not. Diagnosis is very important. As a carer, and particularly as a parent of these kids, I didn't get heard. It didn't matter what kind of statements I put in, I was always just the mum. And it could also be because I've been in this role for so long, they thought I was just, I don't know, spamming them. That's why it comes down to getting professional reports and why it is so important to get that support from the professionals. In rural areas, it is hard. It is really hard. Look at Zoom as an option. I think one of the best things that has come out of the coronavirus event that we're facing is the fact that so many different services now are going onto online platforms. So get used to it. You know, it's not a hard thing. Shyla in particular, she responds really, really well to Zoom because she loves to see her photo at the bottom of the screen when she's reacting with therapies. So that's basically my story. I really am an open book. I'm quite happy to talk about our journey with NDIS and also with autism if anybody wants to contact me later. Thanks, Mark.
Thank you, Deb. And that was most helpful. Now, Liz, I think you're going to talk to us a bit about the resources that are available.
That's right. Thanks, Mark. Just quickly, I wanted to give everybody a little bit of a background of the reason that we're having this webinar, I guess, is that it's supported, as I mentioned earlier, out of the Reimagine Today project. One of the sections of new resources that we have on that website now is a rural and remote hub, and the link is down the bottom. It's reimagine.today/rural remote hub. And the resources that are on there were co-designed with people living in rural and remote areas with the lived experience of mental health conditions or carers, family and other supports in those areas. And it's hard to do something that caters to all of Australia, but we focused in on a couple of communities. We worked with people in Ceduna in South Australia and in Launceston in Tasmania, and those were peer-led processes. We had a team of peer leaders, and so there was one in South Australia and one in Tasmania that worked on those resources. And I thought I'd take the opportunity to quickly plug Reimagine Today on the Rural and Remote Hub. There's a few resources there, but also across the website, there's a lot of useful resources to please feel free to explore, and feel free to get in touch with me to order any of those. They've really tried to make them in plain English. We heard that people in rural and remote areas don't necessarily want online resources, so we made all of these resources printable, and certainly I'm happy to print and post anything NDIS related and multiple copies, so please feel free to email me, or ongoing, it's reimagine@mhcc.org.au. Some of the other resources that are on the website, there's videos and shared experiences. As I mentioned, that's what we've heard a lot of times is what drives people to continue to push with their journeys, is to hear from other people with positive lived experiences of that journey and of the value to them of having an NDIS plan. There's quite a lot of e-learning activities throughout, so feel free to look out for those. And I think it's a continual improvement process that we've got with all of those resources. So please feel free to send any questions or feedback again to reimagine@mhcc.org.au. So we did have a lot of questions come through with the registrations. So now we are going to open up, invite all of our panelists back to do a bit of a Q&A. We might not get to all of your questions today, but we'll definitely endeavour to be in touch with you afterwards with those answers. And yeah, I'd like to hand over to our panel.
Okay, panel. Right, our first question, which came to us as a registration or on registration, can you comment on the advent of independent assessments and their place in the rural and remote setting? Will they be useful, or will they interfere with people getting an appropriate assessment? What are your thoughts? Deb?
There's a lot of chatter at the moment about independent assessments and how they will work. The conversations that I've been having with NDIA has been that they will be sending people into rural and remote areas. I really can't see that they're going to, personally. I think a lot of it will be Zoom. I think a lot of people can't access services at the moment as well. So having a functionality done by an outside independent assessor is going to take away from the pressure to pay for transport through our funding, to get assessments done through the funding. So I think it could be a good thing. Freedom of information, they've said that we will also be able to access those assessments before a planning meeting. Again, that's just something that we've been told, but it's a case of wait and see. Yeah.
And Rowena and Shana, do you have anything you'd like to add to that question?
No, I think like Deb said, there's a lot of chatter about that, and that's certainly a space that we're watching.
Mm-hmm. Do you have any sense of where that chatter is going? What's likely to be the outcome for carers and consumers?
We're unsure, Mark, so we can't
Right.
really comment on the NDIA's decisions.
Okay, right. Let's move on to the next question. How can we grow a suitably qualified workforce with adequate resources to ensure that psychosocial NDIS plans are implemented? Rowena?
Oh, sorry, Mark. So
No, yep, you're fine.
some suggestions are to upskill locally, offer on-the-job training and support within the town, sharing costs of bringing training providers to a town between different organisations. So not just one organisation has to come up with that cost. And try to access where you can online training services.
In addition to that, there are also bursaries and scholarships available from organisations that are have a focus on rural and remote. So if you're an allied health person, for example, you can look at scholarships from the RDN. So there are organisations out there that are really doing their part to build workforces.
Thanks, Rowena and Sharon. Deb, have you got anything you'd like to add to that?
Not at all.
Okay. All right. Well, one of the points that, or one of the things that I've considered over time, and Shana alluded to it in her previous discussion with Rowena, and that is when we start looking at sharing resources and sharing opportunities with other organisations who are operating in that space or in the area. And I've always felt that perhaps there's an opportunity for the Royal Flying Doctor Service, who operate services in the remote areas particularly, to have some input and some capacity to provide some of these services. At this stage, of course, that's not the case, but I think it is something that's worth considering and worth looking at by the NDIA and the RFDS, and see how they can utilise each other and each other's services in a way which benefits the communities that they support. So we'll move on to the next question now. So what can we do to support clients who become disheartened with a lack of follow-up or availability of services in mental health?
Yeah, Mark, I think in this question, if we're focusing on the NDIS services as opposed to those public health services, it really is an opportunity for those participants to use that choice and control and work with their support coordinators and providers to follow that up and ask, why isn't this service not working for me? Why is this person not receiving the supports that they're funded to receive? Is it time to change providers? So I really think it is about using those support networks. If the participant isn't comfortable about speaking up, to go and talk and have those conversations. And it may be that the service provider isn't delivering what the agreement has been, and there needs to be a change. And so I guess use those support networks.
Okay, so would also talking to your local area coordinator, is that, or say a recovery coach, would that be something we could do? I know that Deb talked earlier about keeping in touch with the various aspects of the NDIS service provision and keeping contact and reminding them or telling them that that this service isn't suitable.
Yes, absolutely. So those people are out there for you to talk to, and certainly, you know, it is about empowering. You know, the NDIS is about empowering participants to go out and do that. So using that support person, if that fills their capacity, then certainly use those contacts out there.
Yeah, because there is a level of fear associated with for consumers and sometimes and carers about how to approach or whether to approach the NDIA or the NDIS through establishing connections. So we are facing situations that where people can be reluctant, and we just have to really give them that support and really encourage them. Yeah.
Yeah, I agree, Mark. Helping the people that we work with have a voice, and you know, stand up for what they're entitled to, and so they can have the best possible life.
Absolutely. Yeah. Okay, so what role do you see recovery coaches playing in the support of people in regional areas? And do you think there is, or there will be, an increase in recovery coaches in these areas to offer enough support? Now, to my knowledge, certainly in this region, I doubt we've got one recovery coach, let alone a whole batch of them. So I'll be interested in what you've got to say here. So the question again, what role do you see the recovery coaches playing? Obviously, at the moment, they don't play any.
Recovery coaching is something that is so new at the moment, Mark. It's still being established in metropolitan areas, let alone regional and remote areas.
Mm-hmm.
It really is going to be a case of we're going to have to wait and see. But I do also believe that when more plans come through with recovery coaching, that there will be more people coming on board to provide that service. It's like any of the services. As soon as there is the need, there will be services eventually providing that. In the meantime, however, there are some recovery coaching who will provide this service via phone or via Zoom or whichever platform you'd like to use. That's probably all I have to say about recovery coaching at this stage.
Okay, thanks, Deb. So for anyone watching this webinar who happens to live in a more rural or more remote area, and they're interested in perhaps becoming a recovery coach. How do they go about establishing that status? Does anyone know?
So, Mark, there is a range of different qualifications or peer experience that is needed to be a recovery coach.
Mm-hmm.
Again, it comes back down to plans. If plans are agency managed, they would have to go through a registration process. If they're not agency managed and are either plan managed or self-managed, then they could access somebody who's not registered with NDIA.
Right. So if we had someone who has an NDIS package, would they be able to actually apply to become or take up a role like this?
Certainly.
Certainly?
Absolutely. Yeah. If somebody has the recovery background and has the capacity to be able to assist somebody else after doing training regarding peer support, for instance,
Mm-hmm.
then yes, of course they could start their own business as a recovery coach. That's what NDIS is all about, is developing your own skills so you can live an ordinary life.
Yep. Great. Thank you for that, Deb. Okay. LGBTQ people often find it more challenging to access appropriate NDIS support services in regional and rural areas. How would you suggest that, how would you suggest addressing the lack of appropriate services for LGBTQ people in regional and rural areas? And what advice do you have for such people wanting to access services in these areas? Does anyone want to hit that one?
Yeah, well, I've got some advice. So if local supports do not have specific supports in the area, what supports that are in the area could possibly assist with advocating for this. So access can also be provided through online supports and other services that may be statewide and can be provided from a distance. I guess one of the biggest things is that with lots of different areas within the NDIS, just because the support is not currently there doesn't mean it can never be there. So help your participant or the people and family members that are asking for this help them have a voice and see how we can get it to these communities.
Okay, thank you. And how best can we advocate for individuals in these rural and remote communities to get the mental health support that they need? Does anyone have any particular thoughts around that one?
I can take that one. So like I said, I think when you're in these rural communities, knocking on those doors and exploring the services or the possibilities that are available, knowing your participants, because what works for one person, we know that won't work for another. There's no one size fits all. So it's about building those individual supports for those persons and looking for what's available in that community. One of the things we do know about rural and remote communities is that there is always people in that community who want to support. They want to, I'm not fix, I guess, but if there is a need in the community, we do often see communities come together to create events or support groups for people. So if there's nothing existing in the community, if you have a participant with a certain need, there might be other people out there. So it's just taking that initiative to step outside the box and maybe start something within the community yourself. It might even just be having a barbecue, and after a few occasions, more people might come to that, and before you know it, there is a group and it's a mental health support in that community.
Right. Well, thank you for those important words. So what supports are offered around psychological services under NDIS for people with psychosocial disability? What can people expect around psychological services? Deb, do you have any thoughts?
Yeah. So psychological services, things that people can access through their NDIS funding is not a psychiatrist, because that's more medical and about medication. So psychologists and counselling, social workers, you can do this online, face-to-face if available, but all of the services must relate back to goals. You can't just go in for general counselling, for instance. So if one of the goals was something along managing my behaviour, then the goal would be related back to that. So it would be counselling in regulation, self-regulation, for instance.
Right.
Everything has to relate back to the goals.
So the idea of goals, I mean, it shows me that the NDIS is very much focusing on a recovery orientation.
Yes.
Yep.
Once you get past the how difficult I face life, then it is all based on goals and how you can improve your life.
Yep, great. And do young people who have NDIS plans in regional areas get local support workers, perhaps for Alina and Shana?
I think it depends on how young they are. And I think Deb might be able to expand more on that with her personal experience.
Yep, Deb,
Yep.
you have young people who are getting support?
Definitely do. So when we're talking about local support workers, one of the things that I did is I posted out on Facebook, for instance, and advertised for my own workers. And I had my own set of qualifications that I expected them to have or experience to have. If under the age of 7, there is a separate section of NDIS who do help you out. But I really do find that sourcing your own workers is a much better way than connecting with people who don't understand your own community. Some of the workers that we've had in the past, daycare mums, for instance, we've had one girl who was a teacher aide. She was training to be a teacher aide and she came on board. She found it as a work experience just as much as helping out the children. Again, though, it's not a babysitting role when it comes to kids that are quite young. I think that's where NDIS think that you're using them as a babysitter. But for instance, one story with Shyla, she's now almost 9 years old and she still has problems with personal hygiene and toileting. She knows when she needs to go to the toilet, but she doesn't remember to wipe or wash her hands or flush. So her support worker has actually been helping her develop those skills. Okay, so it's not just a babysitter while I'm working. It is definitely about working towards those goals. And I think that's really important to have in your reports when you do go in for reviews.
Okay, so these are, you've indicated that you can actually source these services yourself. You don't have to go through a particular local area coordinator in order to achieve that. Is that correct, yeah?
That is correct, as long as your plan is self or plan managed. That's why we highly recommend doing self or plan managed in rural remote areas, because you can actually hire people who are in your community already. There are certain stipulations that they must follow. They must have an ABN, they must invoice correctly, all these types of things. And I'm sure Liz has got lots of information about that on the website. If not, NDIS definitely have a lot of information about how you can set up your own workers.
Okay, well, I think that was the end of our questions that we received before the meeting. We've had a few questions coming through here, and I'll just have a look at some of those.
Yeah, so we've sort of answered most of those as we were going. One question that came through via email was that communication assistance is available for people who are without family and friends, and access to current support services to assist in obtaining medical reports to support an application to the NDIS. So what communication assistance is available? I guess basically talking about having support people to support with communication in medical appointments, that sort of thing. Anybody want to field that one? Is
That
it
seems
something
like,
that your
seems like you know,
services
Liz.
do at all? Or if somebody came to you and said they wanted a support person to go to their medical appointment, what would your answer be?
Yeah, we'd certainly suggest linking in. It depends whether they're currently on NDIS. They're not linking in with the LACs. If they're not, there's other organisations. So PHNs are perfect for psychosocial disability, and they might be able to direct that person to a provider who is providing psychosocial services for people not under NDIS, where those supports might be available to go to the doctors and get those reports, support them to find transport and fill in those gaps. So certainly we would say speak to your PHNs who will know what's going on in your region and be able to direct you to appropriate psychosocial support.
Yes, I can add something further to that too, Liz. If anyone's or if the person involved is a patient of their local health district, then reasonably we would expect that they'd have a case manager, and the case manager may well be able to go to the relevant meetings or provide someone that can take them to the meetings as well.
Good. So there's a few options out there, hopefully. It's just about connecting with them, I think. So we actually are pretty much out of time, but I'm glad we managed to get through some of the earlier stuff quickly so that we were able to get to all those questions. And if there's anything else that people wanted to ask, or you don't think your question was answered enough, then please feel free to email me. We can follow it up and discuss it further with you. But yes, thanks very much to all of our guest speakers today, as well as all of you online for joining us. Mark, did you have any other closing thoughts?
Well, I think what today's taught me and hopefully the viewers is that the NDIS is available to people in rural and remote areas. Yes, it's not necessarily as easy to access as it is closer to the cities and in the cities, but nonetheless, it's worth pursuing, and it's worth overcoming the challenges in accessing that service.
Absolutely. Thanks again, Mark, and thanks to everyone. And again, if anybody has any questions, please feel free to get in touch or feedback, reimagine.today. You can also reach me at Elizabeth, ELIS for Sam, at mhcc.org.au. And just as a last note for everybody, because we've been talking about potentially sensitive issues for some people, we recommend that regardless you talk to somebody about it, just to debrief and to talk about how anything might have made you feel. Please reach out and talk to somebody you trust, or feel free to call one of the support lines that's out there, Beyond Blue, on 1300 224 636 for brief counselling and referrals, or there's Lifeline on 131114. And Blue Knot is another good one that I've been hearing very good things about. They're very good at dealing with trauma. And if it's an emergency, call 000. Take care and stay safe. And thanks again for joining us.
Thank you. Bye.
Thank you. Bye.